Amniotic fluid. Amniotic fluid is frequently associated with cytogenetic analysis. Amniotic fluid is a product of fetal metabolism that provides information about metabolic processes and takes place with the progression of fetal maturation. So, amniotic fluid yan yung nasa tiyan ni mother na fluid para protection si baby and i-allow yung movement ni baby. Function. Amniotic fluid is present in the amnion, a membranous sac that surrounds the fetus. Amnion is metabolically active and involved in the exchange of water and chemicals between the fluid, fetus, and maternal circulation. The primary functions of amniotic fluid is to provide protection, cushion for fetus, allow fetal movement, stabilize the temperature exposure, permits proper lung development, and dahil nasa amnion siya, exchanges water and chemicals among the fluid, fetus, and maternal circulation. So, yan yung itsura sa tiyan. Volume. Amniotic fluid volume is regulated by a balance between the production of fetal urine and lung fluid and the absorption from fetal swallowing and intramembranous flow. During the first trimester, the approximately 35 ml of amniotic fluid is derived primarily from the maternal circulation. The amount of amniotic fluid is increased throughout the pregnancy, reaching 800 to 1,200 ml during the third trimester and decreased naman prior to delivery. Kapag ang amniotic fluid level is greater than 1,200 ml, indication ng polyhydramnios or neural tube disorder, structural chromosomal abnormalities, cardiac arrhythmias, and infection. Kapag naman less than 800 ml, oligohydramnios or umbilical cord compression, congenital malformation, premature rupture of amniotic membranes, and decelerated heart rate and fetal death. Chemical composition. Placenta is the ultimate source of amniotic fluid, water, and solutes. Composition is similar to maternal plasma with slough, fetal cells from skin, digestive system, and urinary tract. These cells provide the basis of cytogenetic analysis. The fluid also contains biochemical substances that are produced by the fetus such as bilirubin, lipids, enzymes, electrolytes, urea, creatinine, uric acid, proteins, and hormones. Ang fetal urine, ini-increase niya ang creatinine, urea, and uric acid. Dinidecrease naman ito ang glucose and protein concentration. Fetal age can be estimated by creatinine. Prior to 36 weeks gestation, the amniotic fluid creatinine level ranges between 1.5 to 2.0 mg per dl and then nag-increase naman above 2.0 mg per dl kapag fetal age is greater than 36 weeks. So, differentiate naman natin yung maternal urine from amniotic fluid. So, pwede natin gamitin ang creatinine, urea, glucose, proteins para ma-differentiate natin yung dalawa. Amniotic fluid creatinine does not exceed 3.5 mg per dl. Urea naman does not exceed 30 mg per dl and yung presence ng glucose and protein can be associated for amniotic fluid. And urine, ang creatinine niya is 10 mg per dl and yung urea 300 mg per dl. So, kitang-kita natin yung difference para ma-differentiate natin yung maternal urine from amniotic fluid. And isa pang way to differentiate it is to use the Fern test kasi i-differentiate niya yung amniotic fluid from urine and other fluids. So, yung specimen ilalagay lang sa glass slide, then allow it to completely dry. Then, observe mo kung may fern-like crystals. Yung crystals ay dahil sa protein and sodium chloride. So, kapag meron kang na-observe na ganon, ibig sabihin, positive na amniotic fluid yun. So, gantong itsura niya. Yan. Para siyang mga snowflakes. Sabihin, positive. Specimen collection. Indication for amniocentesis. Amniocentesis, optional procedure that can be done in pregnancy to test for certain genetic conditions and birth defects, usually performed 15 to 18 weeks pregnancy. Ultrasonography yung ginagamit para i-guide yun sa procedure. So, kanino ba dapat gamitin yung process ng amniocentesis? So, mother's age of 35 or older at delivery, family history of chromosome abnormalities such as trisomy 21 or Down syndrome, parents carry an abnormal chromosome rearrangement, earlier pregnancies or child with birth defect, parents is a carrier of a metabolic disorder, family history of genetic disorders, nandiyan na yung example sa gilid, elevated maternal serum alpha fetoprotein, abnormal triple marker screening test, previous child with a neural tube disorder like spina bifida or ventral wall defects, 3 or more miscarriages. So, kapag 20 to 42 weeks naman, ini-evaluate na niya yung fetal lung maturity, fetal distress, HDN or hemolytic disease of the newborn, or the RH blood type incompatibility. So, RH blood type incompatibility, RH rhesus, kapag RH positive ka, meron kang protein sa blood. Kapag naman RH negative ka, wala kang protein sa blood. So, incompatibility, kapag si mother, halimbawa, is negative and si father is positive. So, meron yung effects kay baby. Dahil si negative mother, masisynthesize siya ni RH positive father. So, yung immune system ni mother will make antibodies to attack the baby. When antibodies enter the baby's blood, they will attack the RBC na magkakos naman ng breakdown. So, yun yun. And lastly is to evaluate the infection.
Ngayon, sa specimen collection naman tayo. Amniocentesis. Procedure siya na ginagawa o isang prenatal test kung saan ito ay ma-obtain by needle aspiration para makakuha ng sample of amniotic fluid. So, sa pag-collect nga ng amniotic fluid, the doctor would use ultrasound para madali niyang ma-identify yung location ng fetus. So, ayan sa ultrasound screen, hanap si doctor ng safe place para doon insert yung needle. Una nun, i-injectan muna si mother ng local anesthesia para maging manhid yung surface abdomen niya at hindi niya ma-feel na ganun kasakit pag ininsertan na siya ng amniocentesis needle. So, habang nakatingin pa din si doctor din sa ultrasound monitor para nga ma-avoid yung contact sa placenta or dun sa baby, ayun, itutusok na yung tin needle sa abdominal wall into the uterus and ang last ay sa amniotic sac para makakuha ng sample ng amniotic fluid. And kapag nakakollect na, alisin na yung needle at kukoveran na yung site ng bandage. After nun, i-check ni Doc yung fetal heartbeat sa ultrasound screen if normal pa din ba after nung collection. After nga nung procedure, makakaramdam si mother ng pagsakit sa may lower abdomen niya for about 24 hours after the procedure. Bawal muna magpakapagod si mother. Bed rest muna, bawal muna mag-exercise and iwasan muna yung mga gawain na mabibigat kagaya nga ng pagigib ng tubig and iwas-iwas muna dapat daw sa sexual activity. So, ayan. 30 ml of amniotic fluid ang dapat makolek kay mother. And yung first 2 or 3 ml is dapat i-discard dahil sa pag-insert pa lang ng needle, hindi naman agad amniotic sac yung matutusok. Kasi 'di ba, mother's abdomen muna tapos uterus bago pa makarating sa amniotic sac para makakuha ng amniotic fluid. So, meron na dong blood, meron ng tissue fluid, saka mga cells na pwedeng makakontaminate dun sa specimen na itetest. After na makakolect na ng specimen, itatransfer na yun dapat sa sterile na container. And if ang test na ni-request ay for bilirubin scan, dapat di siya ma-expose sa light kasi maaaring mag-cause siya ng falsely lower bilirubin level. So, kailangan dark-colored yung container na paglalagyan ng specimen at dapat may send agad sa laboratory para ma-test. And doon na papasok yung specimen handling and processing. Sa specimen handling and processing, kapag ang test na ni-request is for fetal lung maturity, after makolect yung specimen, dapat may container na agad na nakaprepare na may lamang ice or yellow bago dalhin sa laboratory for analysis. And pag andun na sa lab, dapat ilagay siya sa ref para ma-prevent or ma-avoid yung activation ng mga enzymes. And kapag ang requested test naman ay for bilirubin scan, kagaya nga nung nasabi ko na kanina, yung specimen is hindi dapat siya ma-expose sa light or sunlight. So, dapat meron kang container na dark colored para hindi maging false negative na yung result for the test. And for cytogenic or microbial studies naman, kinakailangan prior to the analysis of the specimen, dapat ma-incubate siya sa body or room temp. Kasi yun yung way para ma-prolong yung life ng mga cells na andun sa fluid kasi consider din siya bilang 100% accurate for the detection ng large fetal chromosome abnormalities. Ngayon sa color and appearance naman tayo. So, ang normal color ng amniotic fluid is colorless. Wala siyang amoy or di kaya daw ay sweet in odor. Yung iba sinasabi bleach-like odor daw din yun. Kapag naman blood streak, maaaring magkaroon ng traumatic tap or aksidente na naitusok si needle sa epidural vein during the insertion. Abdominal trauma naman kapag nag-separate yung placenta from the uterine lining. If may case na ganun yung nangyari, na may presence of blood dun sa fluid, gagamit tayo ng Clayhour Bedcat test for fetal hemoglobin. And ginagamit siya for the determination if meron bang fetal blood doon sa maternal circulation. Kapag yellow color naman, may indication siya na may hemolytic disease of the newborn or may blood disorder na nangyayari. It is because hindi compatible yung blood ni mother and the baby. So, mamaya mas papalawakin natin para mas maintindihan. Pag naman dark green color yung amniotic fluid, yun ay dahil sa first bowel movement ni baby, kung saan nakakontribute din yun para mag-iba yung kulay ng amniotic fluid. And indication yun na stress si baby habang nasa womb pa din siya ng nanay niya. Kasi yung first poop ni baby is na-discharge na niya or nalabas niya na inside the womb. And nakasama dahil na-inhale na niya yun. And nangyayari yun kapag di agad siya nailabas sa womb ng nanay niya. Or lampas na sa due date. Or di kaya ay matagal yung pagle-labor. And ang pinakamalala kapag ang color na ng amniotic fluid ay dark red-brown, indication yun na patay na sa loob ng womb ni mother si baby. Ngayon, pumunta naman tayo sa fetal distress. Fetal distress, also called non-reassuring fetal status. Term siya kung saan nangyayari siya once na hindi agad may labas si baby sa loob ng womb ni mother. Matagal yung naging pagle-labor or lampas na sa due date kung saan si fetus ay hindi na makalanghap ng sapat na oxygen para makahinga. Kaya minsan 'di ba namamatay na yung yung baby sa loob kasi yun nga hindi na sila makahinga. So pag nagkaganon, kailangan may labas na agad-agad. Isa-cesarean si mother kasi kung ino-normal pa yun, possible na hindi na marinig ni mother yung unang iyak ni baby. Or pwede rin yung ibang method or kagaya ng intrauterine resuscitation. So, ano nga ba yung mga signs of fetal distress? Madaming signs na nangyayari pero most common na lang yung sasabihin ko. Una dun ay yung vaginal bleeding or nagkakaroon ng pagdudugo kasi may placental abruption kung saan humiwalay yung placenta sa uterus. And nangyayari yun kung si mother ay nagkaroon ng hypertension or di kaya ay gumamit siya ng cocaine or nag-take ng cigarettes or uminom ng alcohol na pwedeng maging dahilan para magkaroon ng miscarriage. And ang sunod na sign naman ay cramping. Yes, normal naman daw magkaroon ng cramping during pregnancy kasi indication yun na nag-grow si baby sa loob at kinakailangan din na mag-expand si uterus. Pero, may mga case na mas serious na yung pagka-cramp and severe na yung pain na nafe-feel ni mami. Kaya nangyari yun, contact agad daw sa healthcare provider or isugod na agad sa ospital. At yung pangatlo ay yung pag-decrease ng movement ni baby sa womb ni mami niya. So, 'di ba, isa sa mga nakaka-excite na part sa mga parent at nakakapagbigay joy is yung makita nila yung paggalaw ng tiyan ni mother. Kasi sumisipa daw si baby kung saan. Important indicator yon ng baby's health. If minsan naman ay hindi na feel na gumalaw, ibig sabihin daw nun is natutulog si baby. Pero kung halimbawa daw naman na minsanan na lang gumalaw or sobrang bilang lang sa kamay yung paggalaw, o di kaya hindi na talaga siya gumagalaw, dapat daw magpa-check up na agad para maalaman if okay ba talaga si baby dun sa loob ng tiyan ni mother. Kapag abnormal yung level ng amniotic fluid, pagkakaunti yung amount, ang term nun ay oligohydramnios, kung saan hindi madedevelop ng ayos si baby and syempre di magiging healthy. So, makakatulong na uminom daw ng maraming tubig para mag-increase yung amount. At bed rest lang si mother. And kapag too much naman yung amount, tinatawag yun na polyhydramnios. Maaaring mag-cause yun ng hindi paghinga ng ayos si baby. Magkaroon ng fetal malformation, genetic disorder, or magka-problema sa development. Dito naman ngayon tayo sa HDN or hemolytic disease of the newborn. Katulad ng nabanggit ko nga kanina dun sa color and appearance ng amniotic fluid na yellow, nag-indicate na may HDN si baby. Dito, mas papalawigin natin siya kung ano at paano siya nangyayari. So, ayun nga, HDN, hemolytic disease of the newborn. Blood disorder siya sa mga baby or infants kung saan yung red blood cells ni baby are destroyed prematurely na nagre-result ng pagkakaroon ng anemia. Nagkakos siya ng heart failure, respiratory distress, and edema. Nangyayari siya dahil yung RH ni mother ay negative, pagkatapos si baby naman ay RH positive. So, RH means inherited protein found on the surface of RBC. Ibig lang sabihin ay hindi compatible yung blood type nila. Sa blood type kasi 'di ba may presence or absence ng certain antigen. Sa case na to, nagkakaroon ng incompatibility kasi si baby may presence siya ng antigen tapos si mami naman niya ay wala. So kung halimbawa nga na si RH negative mother ay nagkaroon ng baby na RH positive, dahil RH positive si father, magkakaroon ng problem or madadiagnose na may HDN kung sakali na mag-cross yung red blood cells ni baby doon sa RH negative mother. Nakikita kasi ng immune system ni mother na yung RBC ni baby RH positive as foreign cells, kung saan gagawa siya ng madaming antibody yung immune system ni mother para atakihin at i-destroy niya yung mga foreign cells. Kasi bago sa kanya di niya kilala, di sila compatible. So, syempre, lalabanan niya yun agad. Tapos, yung mga antibodies na yun, parang itatago lang ulit yun ni mother's immune system na parang reserve ulit or panlaban niya ulit kung sakali na may foreign cells ulit na dadating. Parang katulad lang ng bacteria na mag-invade sa body natin, di ba? So, syempre, madaling mag-respond sa immune system. Magawa siya ng antibodies para labanan niya at i-destroy yung mga foreign cells para hindi tayo magkasakit. So, parang ganun lang yun. Tapos, in the first pregnancy, RH sensitization is not likely. Usually, nagiging problem lang siya sa second pregnancy kapag RH positive ulit yung next baby. During pregnancy, pupunta yung antibodies ni mother sa placenta para labanan yung RH positive cells. Kasi nga, nakikita yun ni mother's immune system as foreign cells. So, ayun, lalabanan yun at i-destroy. And ang mangyayari, mag-breakdown yung mga RBC ni baby and as a result nun, magre-respond din yung body ni baby. Kung saan gagawa siya ng mabilis na bagong RBC sa bone marrow and the liver and sa spleen. Kaya lumalaki yung mga organs ni baby. Tapos, the bilirubin is formed. Kung the baby is not easily able to get rid of the bilirubin, edi doon na ngayon siya pupunta sa blood and other tissue and fluids sa body ni baby. Kaya nagkakaroon ng yellow pigment sa skin and sa tissues. Dahil doon, magkakasakit na siya and yun na yung tinatawag na erythroblastosis fetalis kapag during pregnancy pa lang. Pero once na nailabas na siya, yung condition na yun ay tinatawag na hemolytic disease of the newborn or yun nga yung HDN. So, ano nga yung mga symptoms of HDN during pregnancy? So, during pregnancy, walang sintomas naman na mararanasan na mayroong HDN si baby. Makikita lang na may HDN once na nagkaroon na ng prenatal test. So, malalaman na may HDN once na nakita na yellow yung color ng amniotic fluid imbas na colorless as normal color. Yellow color because of the bilirubin, sign yun na nag-breakdown na ang mga blood cells. Isang sign din na kapag nakita na si baby ay lumalaki yung liver niya o di kaya yung spleen and heart. And hydrops fetalis kapag naman si baby ay nakita na may extra fluid sa kanyang stomach, sa lungs, or sa scalp. Yun. Kapag halimbawa naman na nailabas na si baby, malalaman na may HDN siya once na yung skin niya is pale tapos naninilaw, saka yung mga umbilical cord din niya ay may puti-puti doon sa may mata niya, katulad nga nitong nasa picture. Yan. So, paano nga madadiagnose na may HDN si baby? So, una nga nun, kapag nagpunta si mother sa hospital for prenatal test, ay hindi pa pang procedure na gagawin. So, magbe-base sila doon sa mga test na ipe-perform kay mother. So, una doon yung blood test to look for RH positive antibodies. Tapos, ultrasound, titingnan if may nangyayari bang abnormality sa mga organs ni baby or may mga extra fluid ba na andon. And kagaya nga kanina, pe-perform din yung amniocentesis para ma-check yung amount ng bilirubin sa amniotic fluid. And also, the percutaneous umbilical cord blood sampling, kung saan sa test na to, sa umbilical cord ni baby, kukuha ng blood sample para i-check yung antibodies, bilirubin, saka anemia. So, pine-perform tong test na to para malaman if the baby needs an intrauterine transfusion kung sakali na na-destroy na ng RH antibodies yung RBC ni baby. Gagawin yun para mapaltan yung nasirang mga red blood cells. So, ngayon, ano naman yung pwedeng treatment once na na-diagnose na na mayroon ngang HDNC baby. So, syempre, una nun, kailangan i-check muna kung normal ba yung pagdaloy ng blood ni baby. If nakita ni healthcare provider na na-destroy na yung red blood cells dahil inatake na nga ni RH antibodies ni mother, kailangan na niya ng intrauterine blood transfusion kung saan maglalagay sila ng RBC dun sa baby circulation. Tapos kung anemic si baby, kailangan masalinan siya ng dugo. Intravenous fluid naman kapag low blood si baby. Phototherapy naman yung gagawin para matulungan si baby to get rid of extra bilirubin kung saan ilalagay siya sa isang space under a spatial light. And exchange transfusion naman kung saan aalisin yung blood ni baby na mayroong mataas na bilirubin level. Papalitan nyo ng fresh blood na mayroong normal bilirubin level na makakatulong para dumami o tumaas yung RBC count ni baby. And para din bumaba yung bilirubin level. At yung huli, pwede siyang at yung huling treatment ay yung intravenous immunoglobulin. Isa yon na solution na made from blood plasma. Meron siyang antibodies na makakatulong sa immune system ni baby and para ma-reduce yung breakdown of RBC. And paano naman siya mape-prevent? HDN can be prevented. Yan. Maraming mother yung nagpapatas muna na kanilang blood para malaman yung kanilang blood type early in pregnancy. Kung ang lumabas sa test ay RH negative si mother, kailangan niya mag-take ng medicine na RH immunoglobulin kung saan makakatulong yan para mag-stop yung antibodies niya from reacting to the baby's RH positive cells. Then, after na masilang na si baby, kailangan ulit na mag-take si mother ng second dose of medicine within 72 hours kung si baby is RH positive. Pero kung si baby naman ay RH negative, na katulad ni mami niya, hindi na ulit kailangan mag-take ng another dose. So, ayun.
Test for fetal maturity. Fetal distress caused by hemolytic disease of the newborn, too much amniotic fluid, low levels of amniotic fluid, placental absorption o yung placenta nagsaseparates early or before childbirth. Umbilical cord prolapse o yung umbilical cord lumalabas siya agad sa uterus o before the presenting parts of the baby. Fetal lung maturity. Respiratory distress syndrome is the most frequent complication of early delivery and cause morbidity and mortality in premature infant. Dahil hindi pa fully develop yung lungs ng baby, kaya nagkakaganito, tsaka lack of lung surfactants that keeps the alveoli open during normal cycle of inhalation and exhalation. The surfactants keep the alveoli from collapsing by decreasing surface tension and allows them to inflate air more easily. Lecithin-spigomyelin ratio, considered the reference method to test the fetal lung maturity. Lecithin is the primary component of surfactants. Increased production occurs after the 35th week. Spigomyelin serves as control for the rise of lecithin produced at a constant rate after the 26th week. Prior to the 35th week, the lecithin-spigomyelin ratio is usually less than 1.6, rises to 2.0 or greater for alveolar stability after week 35. The preterm delivery is considered safe for lecithin-spigomyelin ratio 2.0 or higher. Thin layer chromatography is used to perform qualitative measurement. Many laboratories have replaced the lecithin-sphygomyelin ratio with the quantitative phosphatidylglycerol immunoassay and lamellar body density procedure. Phosphatidylglycerol, lung surface lipid phosphatidyl is also needed for adequate lung maturity. Normally parallels lecithin, pero pag diabetic maternal, nade-delayed yung production niya. Aminostat fatal lung maturity is an immunologic agglutination test for phosphatidylglycerol using antibodies specific for phosphatidylglycerol that can be replaced the lecithin sphygomyelin ratio. Blood and meconium do not interfere with the test. Foam stability. Perform at bedside. Amniotic fluid is mixed with 95% ethanol, shaken for 15 seconds, and allowed to sit undisturbed for 15 minutes. A continuous line of bubbles around the outside edge indicates the presence of sufficient amount of surfactant to maintain alveolar stability. Yung alcohol yung nakakapag-overcome ng continuous line of bubble kasi siya yung anti-foaming agent. 0.5 ml amniotic fluid added to increasing amount of 95% ethanol provides giving semi-quantitative measure of surfactants amount. A value greater than 47 indicates fetal lung maturity. Fluorescence polarization assay. Phospholipids decrease the microviscosity of amniotic fluid. Fetal lung maturity 2 assay is a reagent system for the quantitative measurement of surfactants to albumin in amniotic fluid assessment of lung maturity in fetus. This assay measures the polarization of fluorescence dye that combines with both surfactants and albumin. Fetal lung maturity 2 calibrators of known albumin ratio are run and the resulting standard curve is stored in memory. Immature results between assay are less than or equal to 39 mg per gram. Results between 40 mg per gram and 54 mg per gram cannot be declared mature or immature. Must be evaluated with caution. This test requires at least 1.0 ml of amniotic fluid. The fluid must be filtered to prevent sedimentation. Lamellar bodies. The storage form of surfactants. Approximately 90% phospholipids and 10% proteins. Secreted by the type 2 pneumocyte of fetal lung to the alveolar space of about 24 weeks of gestation. Increase in amniotic concentration from 50,000 to 200,000 ml by the end of the third trimester. OD of 150 at 650 nm concentrates with lecithin sphygomyelin ratio of 2.0 and the presence of phosphodipids glycerol. Lamellar body count. Lamellar body diameter ranges in size from 1.7 to 7.3 fl to 5 um. Lamellar body count can be obtained using the platelet channel of automated hematology analyzers. The advantage of lamellar body count is rapid turnaround time, low reagent cost, wide availability, low degree of technical availability, low volume of amniotic fluid required, excellent clinical performance. Specimen contaminated meconium or mucus cannot be used.